Do we all have adequate access to healthcare? But what about the people who have limited access to their physicians due to the pandemic? What about those that live in rural areas that are underserved and have less healthcare services available to them? And what about those who are unable to see a specialist due to long waiting lists? Introducing telemedicine. Is this the right call? Telemedicine is a practice which cares for patients remotely without the needs of doctors and patients being near each other physically. With advancements in modern technology, telemedicine is looking like a promising solution. It is important to remember that telemedicine is not used to replace traditional medical practices. It is simply a tool to assist doctors and connect patients when there are external inconveniences. The goal of telemedicine is to enhance the patient's experience and not replace it. Let us look at some of the advantages of telemedicine. Studies have shown that telemedicine demonstrates quality as good as in-person care that is well accepted by both patients and doctors. Telemedicine is also a fantastic tool for overcoming geographical barriers for patients and doctors who are far away from each other. Therefore, telemedicine can break the barrier of having to be in an urban area to have adequate access to a doctor. It is estimated that 20% of Canadians come from a rural population and are only served by 8% of all doctors in Canada and only 2% of all specialists. Telemedicine is also very useful for increasing the efficiency of doctor visits. According to the American Medical Association and Wellness Council of America, almost 75% of all doctor, urgent care, and ER visits are either unnecessary or could be handled safely and effectively over the phone or video. A survey in 2017 found that it takes an average of 13 to 15 minutes for a telemedicine visit compared to 2 hours for an in-person visit. A healthcare environment has a patient-doctor relationship, so what about the patient's perspective on telemedicine? Patients believe the greatest benefit is that they would save time and obtain the same quality of care as traditional medicine. In the process, they also avoid other sick people. In addition to providing care of the same quality with greater efficiency, patients can save money through travel expenses, wages for missed work, or other family expenses. However, they have other concerns. The patients may have outdated or lacked technologies needed to deliver telemedicine and may not have the funds to update or acquire new ones. They may not know how to use the technologies in order to consult with their doctors and thus require education in order to get started. Patients are also concerned with the storage of large personal data. Additionally, patients fear that the time constraint may cause a lack of empathy and compassion as there is potential of humanistic characteristics to be lost due to the virtual environment. Therefore, it is important to consider the patient's concerns for telemedicine so that we can respect their needs and foster a positive doctor-patient interaction. This raises the question, how can telemedicine be improved for the future? Primarily, information technology infrastructures can be established to facilitate telemedicine. This infrastructure will be used to keep patient information confidential and secure. Patients need access to a reliable network. Therefore, mobile and internet service providers can increase the coverage of their services and provide consumers with faster and more affordable services. Additionally, often doctors are licensed to practice medicine in a particular province or territory. However, telemedicine can be placed under federal jurisdiction. This allows doctors to practice all across the country, thereby increasing the pool of available doctors and allowing patients to receive the care they need from the comfort of their home. In order to efficiently facilitate future telemedicine practices, current and future medical professionals need to be extensively trained on telemedicine to ensure patients are provided with excellent care. Therefore, patients require access to a smartphone or a laptop. In addition, government programs should be created for patients to supplement the costs associated with the required technologies needed to contact their doctors. Doctors may choose to communicate with patients through a webcam, telephone, email, or other mobile applications. Therefore, public education efforts should be adopted to teach individuals who are unfamiliar with these technologies and platforms. In conclusion, telemedicine is still in the developmental phase, while its current need has been amplified due to this pandemic. Telemedicine will continue to develop, progress, and change as patient feedback is received. This feedback is crucial as it will help to improve user experience and continue to foster healthy patient-doctor relationships in the foreseeable future. Telemedicine is not meant to replace traditional healthcare, but rather it is used as a tool to enhance the quality of care a doctor is capable of providing. So now we ask, is telemedicine the right call for the future of our healthcare system? We would like to thank the IPF Lung Health Support Group Hamilton for providing us with the feedback and their direct experiences, concerns, and suggestions for telemedicine.